Right, so a couple of the troubles with the face masks and hearing is obviously the loss of visual cues. So when we have the masks on, we're not able to read lips, and everyone reads lips to some extent. So without that, it causes some difficulties because you're relying solely on the auditory system. Another trouble with the masks and COVID is we've been increasing the distance between person to person, so that also causes a reduction in the sound quality.
Absolutely. And some research has actually been done which is showing that having the masks on is actually attenuating or reducing the amount of sound we're hearing anywhere from about 10 to 12 decibels. And especially this is happening in the high frequencies, which is where we get most of our clarity and detail of speech. So when we're not treating a high frequency hearing loss and we're actually covering up and blocking more of those visual cues and the high frequency cues, it's a lot harder to actually understand what someone's saying. Absolutely. So there's a certain frequency range where we know we can increase to help overcome the blockage created by the mask. And in some cases, we can create a mask program where if you're out and about, you have a particular setting that's allowing you to get more of the clarity. And then when you're back home and it's safe to take the mask off and you're around really a quiet situation, then you can go back to your normal default setting. Absolutely. So depending on what kind of technology they're in, we work with all sorts of devices, all kinds of technology. And so it's not very often that we're not able to help someone by making adjustments to help them overcome their difficulties.
All right, terrific. Well, thank you, ladies.
Of course.